Hi, my name is Mike Tracy. I'm the owner of Universal Diagnostic Testing. We are both a sleep laboratory and a sleep therapy clinic. One of the unique things about our clinic and laboratory is that we were really one of the first to embrace the use of home sleep testing. The test is actually done by, you'll be given a shirt. It looks like the one I have on. Actually, there's a recording device inside the shirt, and you'll notice that there are belts on the chest and around your abdomen. Now, when you get the shirt has been pre-sized, as have the belts. So really all you have to do is put it on. We get actually quite a lot of data when we do this test. It isn't the same as actually coming into the sleep laboratory, but for our purposes, that is finding out whether or not your CPAP pressure is still effective and effectively treating your sleep apnea. It's a great tool that really up until recently has not been available to us. So this is generally the first kind of test you'll be doing. The only thing you really have to do again is to put the shirt on and to put the pulse oximeter on. Okay, the pulse oximeter comes pre-wrapped with your shirt. You'll find that there are three parts to it. There's this strip of what we call Coban tape. It's an elastic sticky tape. You'll peel that off first. You'll notice that there is what looks like a sports wristband, and that's exactly what it is. It just unfolds, and generally what I do is I rest the wristband on my knee, and I will put the wristband on, as you can see. The most important feature of the pulse oximeter is the eyelets. You'll see that there's a piece of tape, there's an adhesive covering that you're going to peel off here. Now, it's important that you properly position this probe. There is an eyelet down here and an eyelet up here at the top. It's critical that when you put it on, that you place the first eyelet on the pad of your primary finger. You'll then fold the flaps up, as you can see, to secure it in place. Then what you're going to do is wrap the second eyelet around, and you'll notice, if you can see this, there's a picture of your fingernail with the eyelet properly positioned. You'll wrap that over and then just bring this tape around like so. Now, the idea behind this is you want these two eyes to be looking at one another through your nail bed. Finally, to reduce motion artifact, we take this Coban tape that you set aside and we loosely wrap it around your finger. Now, the goal is not to make it so tight that it's uncomfortable. We just want to secure it so that you reduce the amount of motion artifact that you see at night. Once you've got it on, you can just sort of squeeze it, and the tape itself, its common properties will cause the tape to just sort of adhere to itself. That's really the only thing you have to do when you're doing a home sleep test. Now, if you're going to be wearing your CPAP, you will also have this CPAP tube attached to your sleep shirt. And on the night of the study, you're going to replace the CPAP tube that you're currently using with the one provided to you that's provided with the sleep shirt. It's just a matter of replacing the tube that you're currently using on your machine with the one that we provide you.